On today's podcast.
So you can't just start killing off all this bacteria in the body if a child is not pooping normally, right?
Mhm.
So again, I just don't think that, and that's where unfortunately a lot of our professions, and I mean, you know this too, is just we'll get like this bad name. And it's just because not everybody's kind of thinking through the process of what we need to do.
If you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Good morning, everyone. Jen Rivas here, alongside my friend and colleague, Dr. Emmy Brown, and today's episode promises to be both enlightening and empowering. We're living in a time where parents are becoming increasingly discerning about their children's health. They're seeking more than just the conventional medicine's disease-centered approach. They're yearning for a patient-centered focus that truly addresses the unique needs of their little humans. And that's where our special guest comes in. Jessica Pawlicki is the visionary behind Well-Rooted Pediatrics. It's a practice that champions functional medicine, delving into the root causes of chronic illness, rather than merely addressing the symptoms. But she doesn't just stop with children. Her practice also extends to her expertise to adults, making it a one-stop shop for the entire family's health journey. Her approach is a harmonious blend of traditional and alternative medicines, all backed by science. She's on a mission to elevate your health beyond just being disease-free. Jessica, it is an honor to have you today, and I cannot wait to dive into this subject. Welcome to the podcast.
Awesome. Thank you so much. I'm so happy to be here and be able to share what I know with everybody else.
We're so glad to learn from you, Jessica. And before we get into the nitty gritty, I'd love to know why medicine, why nursing, and why pediatrics?
Great question. I get this a lot about our why and just how we got here. So, ever since I was little, all I knew is that I wanted to be a nurse. And so whether that was going to be mom, baby nurse, OB, pediatrics, I wanted to do something. So in high school, I got my CNA my sophomore year, and I actually would work in the hospital in the PM shift all through the last 2 years of high school. Oh. And so I've been in healthcare since I was 16. So I've watched it evolve into a whole new of what it was then to what it is now, which is a very interesting experience. And then when I graduated nursing school, I was actually a hematology, oncology, and hospice nurse. So at that point, I think I realized a lot of just alternative medicine just wasn't encompassed in that. And I'll never forget one patient that I had that just, she kind of lived past what they thought she would based on like different approaches, different supplements, juicing. And it kind of planted that seed for me of there's got to be another way. And when I had my first baby 10 years ago, I went through my own little infertility journey, dealt with some miscarriages. No one had the answers. And at that point, I learned that I had MTHFR and I needed to work on some detoxing and through some other things as well. So I started to be my own advocate in the health system and went right back to grad school because bedside nursing just wasn't what it was when I started, back when I was 16. So I knew that was not what I wanted to do. And pediatrics kind of just fell into my lap with my first position. However, it was all conventional, right? So I walked in on my first day. I was given that piece of paper of like the top 5 antibiotics, the top 5 medications, the medications that are covered by the insurance, how you need to prescribe them, all these schedules. And I was just like, oh my goodness, this is literally just like this copy paste care that not what I wanted to do. So I built my foundation. I got used to my environment. And then I slowly just started to learn more, got into functional courses, became functionally medicine trained, and just kind of developed into where I'm at. And being able to be in this realm where we can still utilize traditional medicine, but focusing on why things are happening and giving parents answers is just absolutely incredible. And I always say we are confident with the results we have, and we are confident with the symptoms that, overcome with that. But it's been a long journey, and I didn't just get here overnight. And the purpose of that is people always wonder, I'll get emails, can we spend 5 minutes just talking about how you started? Like, it's not a 5-minute conversation. It's a 15-year conversation, but my passion lies here. And I'm so blessed that this is where God led me, and this is where I'm at today.
That's awesome. You mentioned one kiddo. How many do you have, and what are their ages, if you don't mind me asking?
Yeah, I have two. My daughter is just turned 10 last week, and then my son is 7. So it keeps us very busy. They're both in travel, softball and baseball, and then we homeschool them. So
Wow.
always on our toes.
Crazy busy. I admire that.
Amazing.
And really your business model is unique. I don't think that I know you offer primary care and urgent care services. It's primarily pediatrics, is that right? But you also
Yes.
see adults? Yeah, very
Yeah.
cool.
We have a second entity to the business. So we have Well-Rooted Pediatrics, and then we have Well-Rooted Functional Medicine. And our functional side is our adult side, where we have separate providers and separate staff on that end.
Yeah, super comprehensive. So, and we really want to focus on pediatrics today, Jessica. So, what are some of the most common pediatric conditions you work up and manage?
So I think lately I've been, ever since COVID, right? The whole shutdown through all that stuff, I think a lot more neurological things have come about. So more ADHD, more focus issues, more behavioral, right? So, ODD, or just being defiant, not knowing like how to put that behavior into reality. We've seen a lot more like pandas cases, a lot more strep cases where it's crossing that blood-brain barrier. So it's interesting. And the way that it's all evolved, it's all related, right? So with those kids come chronic constipation issues, eczema and allergy issues from like a small little baby. So digging deep into these history, those are kind of like our big main things that we focus on, from the gut, to the brain, and just being able to look at all the things in between.
This is hitting home for me right now. I'm actually dealing with something with my middle child, which we believe is allergy related. So I'm kind of curious the journey that most parents kind of find you, Jessica, because I have to be honest, I feel like it's something you have to really advocate for. You have to kind of like peel back the onion to find providers like you, which are just such a treasure to parents. Do you find that most parents have gone the conventional route and they've exhausted all their options, and so it's just them digging to find you? Or, is it something else? Is it referrals? How do parents come to you?
Yeah, I would say it's a good mix of both. I mean, we definitely have our conventional parents, and I think we all need to think at some point we were there too, right? Like we didn't know about any other, entities or resources out there, and you'll do anything for your child, right? So to go to an ENT or an allergist or a pulmonologist or whatever the story is. So they'll start there, and then they don't get the help. And I think with social media being so evolving, it's a good and a bad thing, right? But with social media and kind of people posting in mom groups and kind of getting more of that, they're saying, well, have you looked into functional medicine? Have you checked out X, Y, and Z? So then being more in a local group, people are saying, well, have you found Well-Rooted Pediatrics? And we do our best to try to get as much as we can on social media, on Instagram, getting our names out there, because we do have the capability of seeing some kids virtually in certain states, and we're hoping to continue to build that. Right now, we're in 4 states. We're in Illinois, Wisconsin, Iowa, and Florida, but not many people know. But those referrals are huge, right? So now you help one family, and then they talk to their sister-in-law, and now you have another, and it just kind of keeps going. So it's definitely a good mix of both, but I'd say a lot of ours is referral based.
Gotcha. I just want to pull on that there just a little bit before we continue with the virtual. Do you find that, especially with children, right? I feel like adults, might be a little bit easier, but with children, how are those virtual visits going? Are they more challenging? What sort of struggles are you facing there?
They're not, because a lot of the times the kids don't know how to put their symptoms into retrospect, right? So the parents are kind of saying, like, here's what I'm seeing. Here's the changes that we've seen evolve. And even a lot of times when the kids are in the office and we're asking them, they're like, I don't know. Or
So
like,
true.
they
look
just
at
don't
mom or dad.
understand.
Yeah.
They do. So we're able to kind of get through some of that stuff. And then if it's anything that we need to see, technology is great. So pictures, videos go a long way. And obviously we don't do our primary care. We don't do checkups virtually, but all of our chronic conditions we definitely can do. And all of our workup can be sent, via lab order or whatever we choose to do with that workup.
Gotcha. Technology is a beautiful thing in these cases. So
it definitely is.
Yeah, and it's great to hear that you have that wide-reaching ability virtually. But I'm curious about the acute care visits, because I think so many functional medicine practitioners, of course, the complex cases are the fun ones, the challenging ones, the ones that we're thinking about when we go home. But the acute care visits can be more gratifying a little bit here and there if you can give relief. So I'm curious, I'm sure you're seeing a lot of sore throats. I wonder about kind of the COVID cases that you were seeing, if you were seeing COVID in your clinic. I mean, what kind of holistic therapies are you using alongside traditional medicine?
Yeah, I think it's just like you said, backing what we can, right? So just knowing that like 85% of ear infections are viral, for instance. So stating that like not every kid just needs an antibiotic, that doesn't mean they're not going to have a fever, right? That doesn't mean they're not going to have ear pain, but it's
Right.
what extra modalities can we use? So there's tons of studies backing like garlic mullein oil in the ears. So like we'll do that, we'll utilize homeopathy and those cases resolve. And in the few that, we need to do antibiotics or the parents choose for that, we're there to empower them. So we're there to educate. If a parent comes in and they say, I'm like, this has been going on, like, I want an antibiotic, we listen and we give. But now we're restoring the microbiome, right?
Mm-hmm.
So we know that an antibiotic will ruin that gut health for at least 2 years of that disruption, causing dysbiosis or imbalance of bacteria, overgrowth, candida, etc. So we're proactive in that sense. And especially under the age of 2, we're making sure that we're doing supplements prophylactically to ensure that that gut's not going to become leaky and we're not going to have issues from that. But there's a lot of extra things. Like I said, the supplements, garlic oil, homeopathy are probably our top 3 things that we do in the office to be able to use, coincide with that. And it's a blessing because most of our kiddos don't need antibiotics. Now, don't get me wrong. There's a few things that we automatically will use antibiotics for: strep, UTIs, pneumonias, staph infections, things like that. But then we know that we can fix it on the other side. And that's what parents appreciate more is like, they don't want to do the antibiotic, but they're not going to be neglectful or negligent either. Right.
Of course.
So we have to be, and even with us being medical and us having actual medical licenses, it's a little bit trickier sometimes for us to be able to follow suit with that. But we'll just always back our plan with just a restoration protocol so that we can ensure that we don't have any side effects.
I love that.
There's a time and a place, and education.
There really is.
Informed consent, make sure all parties understand. And like you said, Jessica, we can always restore. I like to give Saccharomyces boulardii with an antibiotic if it's indicated, right? That's just kind of a really nice mainstay, but it can be difficult when parents just want to knock out an infection that they believe is bacterial. But like you said, so oftentimes it's viral, and we just get so used to thinking that these common upper respiratory infections are bacterial when they're not. So I think that's really important, just to kind of, and that's common knowledge, I think, at this point for a lot of functional medicine practitioners. But coming up against parents who might be a little bit more set on this or that, and giving advice, I think is helpful. So thank you for that. I think it's really kind of, it can be tricky dealing with parents when, the patient can't communicate as much as we would like them to, as you said.
Yeah.
Well, right. And parents are in all different parts of their journey, right? So if they're brand new to this and they're coming in and we're saying like, you're going to do all these things, they're like, oh my gosh, I don't even know what to do. So like, even when we're paged, over the weekends, I'll say, do you have any homeopathy on hand? Do you have these things? And when they say no, I don't go there, because to tell somebody to do all these things when they're not comfortable with it is very hard. And then we revisit that another time. Like, hey, here's some things to have in your toolbox, so that when these things come up, we can guide you through it. So gentle approaches, but small baby steps.
I love that. And that's such a beautiful approach, because it can be very overwhelming for parents. And it also can sometimes, I've been in doctor's office where it feels a little condescending. So for you to really meet them where they're at, I'm sure they appreciate that. And
absolutely.
Right?
Yeah.
So again, kind of talking about the population of these little ones, I imagine it's pretty challenging for you sometimes anyway, because you have 2 views, 2 personalities to deal with, or at least 2, right? If it's both parents and a child, you've got 3. So what would you say are some of the most challenging, but also the most rewarding parts of working with children in that scope?
Yeah, I think, like you said, the most challenging is not knowing exactly what they feel and how they feel it, right? You and I can pinpoint what starts first and then how that entire cascade goes about, right? They don't. And what's hard is they just go from like 0 to 100. So there's like no brake pedal. They just are on gas all the time when they're dealing with these challenges. So for us, I think it's just been the experience over the years of knowing how the body works and where we need to start foundationally, and then how we can backpedal and like just kind of make sure everything is up to par. The most challenging is when like two parents don't agree on different treatment options. One maybe just wants the antibiotic, the other wants to try supplements. And so it's kind of finding that balance and trying to educate parents as much as we can. And I use a lot of myself in that, hey, I started here. I get it. This is new. And like, I'm not here to overwhelm you, but like, let's just continue to like communicate and educate along the way. But the most rewarding and, is when we see our kiddos for our 6-week follow-ups after their functional visits, and they are now completely focused in school and they're not getting any write-ups, or they're not having any more ticks, and they haven't had any fevers with their periodic fever syndrome. They're no longer constipated. Their skin is cleared up. Like I could keep going, right? And those visits just make me smile ear to ear. And every time I hang up the phone, I like tell the office, I'm like, we did it, because it's so fun. And that's the best part. And especially when parents have been struggling for years and years and years to try to find answers. And then within 6 weeks, we got their ticks to stop, or we cleared up their belly pain that they have been crying about, daily for months and months and months. And, it's hard to get them to take supplements, right? It's hard for parents to kind of develop that plan. And we work really closely. We have, 3 different FNTPs on staff. So we work with like different nutritionists and try to help them along the way. And we check in with them biweekly, because if you just leave a parent to do all these things when they're not used to it on their own, they fall off. And that's the problem, I think, with a lot of different practices is, parents will come in and they were given 20, 30 supplements to take. But you're not going to get that in a 2 or a 3-year-old. It's just not going to happen. And then you tell a parent to restrict their diet completely and they can have 2 things. And, again, it's so we've kind of just developed where's the compliance versus what's sustainable, right? Like what's the reality of your everyday versus like, if you slip up one day, it's okay. Like we're here to help you, because that's what reality is. But like most of the time, like we need you to follow into this. So that rewarding part, just like learning those life's challenges and getting them through all of that's huge.
Yeah. And like you said, we'll do anything for our kids. So for a parent, what relief that must be to see that. What a gift you're giving them.
Thank you.
And I'm wondering, Jessica, of course we individualize cases, we have to, but for parents who are new to the functional medicine world, are there any kind of foundational therapeutics or any kind of information that you send home with parents after an established care visit, like, a benchmark for fiber or, colorful fruits and veggies? Is there, goals for just really basic stuff, hydration, to pull out these inflammatory foods? Do you have anything like that that's kind of universal for?
We do. And our nutritionists help break all that down for them. So like at their first visit with them, they're able to see like where those challenges are, right? So is it the food, like you said? Is it the intake? Will this child just like only eat foods that are red? Like, what is it, right? Because we do have some sensory stuff, and as simple as it seems, sometimes it's not simple. And so we then balance it off of there. And then we say that the small steps, right? So like, don't go reinventing the wheel. Don't literally change everything in your child's diet, because you're going to overwhelm that child and they're going to go on strike and say, peace out, I'm not doing any of this. So we have those resources, and yes, we break it down just gentle step by steps. Focus on just removing gluten and inflammation right now. Let's focus on just moving more and increasing your fluids. Let's put them on a little trampoline and see what they can do on there. Let's start some castor oil packs because they're sleeping, and that's going to be really easy. Small things like that, we really can just integrate. But having our help, and I always tell them, like, we got you. So you can call us, you can email us. You have these weekly or biweekly consults with the nutritionists. They're there to guide you, because it's going to take a good 3 months for you to develop this routine, and that's how long that we kind of stay by their side.
Right. It's really kind of developing these habits. And I saw that you have a call line open 24 hours a day. Which is
we do.
Oh, that's extremely valuable. And so now I'm wondering too, we've kind of touched on it a bit, but how would you gear this towards counseling other providers who are trying to get parents to be a bit more compliant, and especially with adolescents? Because I definitely want to talk about that situation. We were talking about how little ones can have a hard time articulating, and depending on the adolescent, I see that also. Sometimes they're very autonomous and they're speaking to you and they're not looking at the parent or the caregiver. But how do you counsel other practitioners who are trying to maybe get adolescents to be a bit more compliant, or, and then also parents?
I think it's just getting to their level, to be honest. So many providers just kind of like, here's your plan, right? And I don't know, you have to find your why. You have to remember why you're doing this as a provider. And you have to connect with them on that level. So just more like giving those testimonials, like having them talk with other parents in your practice, having a list of parents that are totally willing to speak to people like, I've been through this, like this is what worked for supplements. This is the smoothie that we found that covered the taste of X, Y, and Z, right? So those gentle approaches, I think just more like remembering that we are human before we're providers is huge. And that's I think the big difference of where we are. Like we have 46 of us and we all have the same vision and we all are on the same trajectory when it comes to our beliefs, which was very hard to find, but it was worth the wait to find all of them. So when a parent calls, like every single person in our office can relate back to them and say, okay, this is what I went through, or here's my recommendations. And we just talk to them as people. So my goal over the next few months is going to be to build that mentorship program with providers, because I do think more people need to know how they can do this, and they can do this because, one person can't do it all, right? Like we can't do it all. We can't be in every state every second. But I know other people can do that. But just remembering like who you are and what your why is, and just connect to them as humans.
I want to talk about your intake form because we know that's such an important piece in functional medicine and you really have to go deep. Is there anything that for you feel is kind of unique about your particular intake form and process?
No, not really. I mean, we've edited it over the years to kind of figure out, what's more important. We want to know what they've already tried, who they've seen, what kind of testing they've had, when the symptoms started. And sometimes people don't even know until we're sitting there going through the entire H&P, and we know when to ask these questions, right? So if a kid started with sudden onset of a tick, let's go there. Was there a new classroom? Was there a big trauma or event? Was there a car accident? Like, what could have potentially triggered this child? And there's so many times it's like, oh yeah, they switched classrooms in school. Or, we actually moved 2 months prior, or we remodeled our bathroom actually the month that this started. So then we can start to get these red flags of, okay, maybe you have some mold going on. Maybe there was just this whole release of toxins, right? That barrier was kind of already on the teeter-totter, and then we just kind of went up. So the intake form is allowing us to be able to hone in on some of that stuff, but a lot of the times parents don't even know. So it gives us a foundation, and then we just sit and break it down through our H&P and be able to like grab all that history from them and put it all together.
Makes sense.
And it's crazy to think that as healthcare practitioners, I mean, everyone gets really good education in terms of history taking, but you think about a lot of practitioners, they don't get that granular. They might say, oh, was there anything stressful going on at this time? Or, like you kind of touched on traumatic brain injury, accidents, whatever, like maybe it's just being rushed for time, but getting really specific, like the remodeling or environmental exposures or, trouble in school specifically, not just like, oh, do you have friends or not? But is it a new school? I switched schools in second grade and that was kind of rough. So
and sometimes it's as simple as, it's like the whole house just had strep, but he was lucky he didn't have it. And it's like, well, did he or did he not? Right.
So again, asymptomatic in that way.
Correct. So then we start to dig, and then we do their labs, and like their ASOs are positive and their DNases are positive and their neurozoomers are like, woo. And we're like, hey, we have figured this out, So it just takes a lot of digging on our part, but we don't stop. Like we will until we find like that, like aha moment. That's when we start. So
dig. Yeah. And on that note, Jessica, I'm curious about mom's history, for example, in terms of toxin exposure prior to pregnancy, during pregnancy, breastfeeding, what was going on with mom? Do you ever go there? Depending on 100%.
The case. That's just it. It's depending on the case. So especially if there's nothing that's like 100% that stands out, like the things we just talked about, we'll start to dig into mom, right? So let's just say this baby started with issues at 4 months old. but they have lived a really good lifestyle. It's okay. Well, what could have happened, right? Like, how was your gut before you got pregnant? Oh, it was terrible. Or I actually had a bunch of fillings removed, right? Or I moved, or they put me in a new building at work, or my stress was absolutely crazy, right? So we can kind of start to dig on that. Were they group B strep positive, and were they given antibiotics? Was it a completely traumatic birth, right? So was the nervous system just completely wrecked from that initial induction to the forceps that were used to be delivered for baby? So it can go deep, but mom's history is huge. And I literally did it, made this comment in a reel we did not that long ago, that if you're concerned about like your trajectory of your children, your grandchildren, like you need to make the changes now, right? Because like the eggs that like those your kiddos have are going to determine like her kids and like her kids' kids.
It's
right?
wild.
It's so wild, but like we have to be better and we have to do better. And so many people, thank God, I feel like have come around to know that and have made those changes. And that's what I love about our practice is everybody chooses to come to us, right? Like they're not forced to come to us. So we just sit and have these conversations all day long. But yes, it definitely goes deep into mom's history for sure.
Now, you're an expert in pediatrics, right? So I always like to ask when we have someone like yourself on here, and I know it may sound cliche, but like what practical tips do you have for both providers and parents alike in raising healthy kids? Maybe something that's not even on our radar. Like you're a parent yourself. What are some of the day-to-day things you do to try to, make them more risk averse where they're not having to come to see you?
Yeah. And I mean, and like you said, sometimes it's not as simple as what others think. So like we don't do gluten. We avoid food dyes, when possible. Again, my kids are in travel sports. So yes, they're not in school, but if there's a situation, like we just do our best in those situations. My kids take daily supplements. So we're making sure that we're able to focus. We're doing liver tinctures. They're doing vitamin D. We're doing probiotics. We're doing SPMs is one thing that we take often. So we're just kind of making sure that those cells are just nice and strong, their cell walls. But they're always outside. Get the kids outside. It doesn't matter if it's raining, if it's snowing, if it's cold, if it's hot. Like our kids are always outside, just playing, exploring, grounding. Screen time, limiting screen time. And again, it's a disadvantage even for, parents may not do it, but then these kids are in the front of the screen sometimes for 4 to 6 hours. Yeah. So sometimes it's out of their control. But limiting the screen time is absolutely huge. And just constant communication. Like we stick up with, what's going on. How are you feeling? Where are your emotions? Expression. A lot of kids don't know how to express themselves. And then they get adjusted. Chiropractic's a big thing for us as well.
Oh, cool. Very cool. Tell me what SBMs are. I'm sorry, I'm not familiar.
Yeah. So just more like pro-cell mediators. So it kind of is more of a different type of an omega, if you will. So you're looking at your 3s and your 6s, but you're more of like a preventative measure. So it's a good immune modulator. So it just helps to support that immune system, but keep that cell wall nice and strengthened. So that mitochondria is always doing well. There's nothing that's going to kind of pass through. We do it a lot for like a stronger anti-inflammatory for like our pandas kiddos, or any sort of thing that we need to use a biofilm for.
And what about testing, Jessica? We mentioned it just a tiny bit, but are you using organic acids, which tends to be pretty popular in the pediatric population because it's urine, especially with the complex cases? I'm curious if you do run organic acids, because if we don't really know where to look first, if we're thinking maybe this is, like if there's a tick, you might think neurozoomer, but there's also maybe some gastro stuff going on, but you're not quite sold on doing a full-blown stool panel yet. Where do you kind of go with those complex cases and in the variety of tests that you choose?
Yeah. So we do labs on a lot of people as a general start. And then based on what that initial conversation is, determines if we're going to wait for our labs to come back to see if we're going to keep going. In terms of do we need now a neurozoomer? But like if I'm getting a positive, ASO on labs, like I'm not necessarily going to jump there right away because chances are, we have these things going on. And I think with our experience, that's where we differ is we don't just rely on tests to tell us the answers. We use our minds and our philosophy. I mean, we have people that come in and they were given 5 tests by a provider off the bat. They spent $2,000 and still don't have answers. So we have to know that testing these kids is not the answer. We have to think of the 101 of how the body works, right? But we do start with labs and then we build off of that. So I actually don't like the oats test. I am one of those odd people. No one in my office really likes it. We will review tests, if parents have already brought it in, but we tend to more, again, just specify on what's happening. So we use a lot of the TTB, so the total toxic burden, right? So we're looking at metals and molds and different environmental toxins. We do the gut zoomer often. So any sort of GI issues that are more consistent beyond 3 months, we're automatically jumping because there's no time to mess around with these kids, right? Like we don't have months to try to fix them. Like their body is already vulnerable. They're in this state of fight or flight. Like we need to stop it now. So guessing on supplements is not the answer. So we just go right into the gut zoomer and we figure out exactly what's happening to build that foundational layer. And then if we have a kiddo that absolutely needs more work, looking into the neurozoomer, looking into Tick-Borne, the tick zoomer, and kind of looking for like tick-borne diseases, it all just kind of depends on what our story is. But we don't like to utilize the testing if we don't have to. But also, we build the case with the parents, right? So communication's so much key, and they trust us. So if I'm telling them, I need you to do this, they do it. Like people are, well, how do you get your parents to do things? Because we talk to them as humans, and they trust us. Because a lot of people struggle with just getting people to do testing. But I think we have to build the foundation and explain to them where our minds are going and not just tell them why they have to do something.
That's so valuable, being really judicious in how you choose testing and making sure parents understand. So I think that's so powerful because you're saying, well, if I feel confident in the clinical assessment and the history, maybe it's not indicated, but when it's really indicated, they know that you're confident that that's going to change your management. So I think that's huge. It seems obvious when we think about it, but to really put that into clear terms for parents, I think that's huge. Really building that confidence and of course, stool testing is so foundational, as you said. But I'm kind of curious. I want to pull on this a little bit with Tick-Borne because I do think that rates are underestimated overall. And then with toxic burden being so prevalent, where do you start there? If, for example, you do have a tick-borne illness in a kiddo, but there's also a slew of toxins showing up, environmental toxins, maybe some mycotoxins. There's a school of thought that mycotoxins, of course, are immunosuppressive. Do you start there? I'm just kind of curious overall, if you do have a case of a tick-borne illness in a kiddo with a high toxic load, what's kind of your approach there?
Yeah. So especially if we're dealing with more like IgGs for tick-borne stuff, we're starting foundationally, right? So are they clearing things through their gut? But is their liver working as it should, right? So we do a lot of different, just start off of like liver detox, working through the GI system, making sure these kids are pooping. You'd be surprised how many don't. That's or huge. Not regularly. So you can't just start killing off all this bacteria in the body if a child is not pooping normally, right? So again, I just don't think that, and that's where unfortunately a lot of our professions, and I mean, this too, is just, we'll get like this bad name. And it's just because not everybody's kind of thinking through the process of what we need to do. So we just break it down. If there's something that's more significant when it comes to tick-borne stuff or like IgMs, we have an awesome LLMD that we refer to because she is just guru god in the functional world when it comes to treating Lyme. And that is only what she does. So I rely on her a lot for that. But we start with that liver, we start through the GI system and foundations, and then we start binding, like getting rid of some of these toxins, figuring out exactly where this overload is. We use a lot of cell core products, and those have a great response with kiddos using the carbon technology and using the fulvic minerals because we're missing a lot of that stuff in our day-to-day anyways.
Totally. How are you getting kids pooping? I have to know.
Yeah. So definitely multifactorial, right? So if like their GI test is terrible, sometimes it's just filling the gaps, right? And killing off the overgrown bacteria, using some biocidin, whatever the story is. But castor oil packs are absolutely incredible for some of that stuff. And even if the pack's not going to work, doing it just inside the belly button, focusing on the enzymes. Most kids are not chewing their food, right? Like their kids are finished before you even start, right? Yeah. So making sure that making sure that they're doing digestive enzymes just to kind of fulfill and take off some of that load of the pancreas and the way the body's breaking that stuff down. making sure that they're doing some fermented foods and or at least a probiotic and prebiotic if absolutely needed to get through some of that. And then again, going back to the minerals and how we're more deficient, magnesium is huge. Most people are completely deficient in magnesium. And people are only checking different serum levels when we're not checking like RBC levels and actually seeing what's in the cell. So when we're doing that, we're seeing so many deficiencies in these kids, and just again, filling those gaps will allow them to poop. But we have to think bacteria don't want to die, right? Viruses don't want to die. Parasites don't want to die. Oh, and that's a whole nother topic. But everything's just kind of like there. So we have to think if they're pushing that hard back on us, then we need to use biofilms to, like I always say, it's like Pac-Man, right? Like the cell with an aura, and like Pac-Man's got to come in, eat away to like disrupt that bacteria, right? And as long as we can think of that's how it needs to go, these kids will poop. No, don't get me wrong. Some are holding, right? Some have become like a pelvic floor dysfunction, and we're working with vibration plates and OT just to kind of get us to do some of that. But a lot of it's just very simple 101 strategy.
And it works. If people are consistent and they understand that there's a stepwise approach, it works. And I think that's really important for people to hear, because and we think about this stuff in adults, but it's the same thing in kiddos, even though we assume they should be digesting optimally, but it's not the case in the modern day world, unfortunately, due to so many factors. So I think that, thank you for bringing that up and bringing that to light, that, you know, even kiddos need to sit down, chew, savor, and maybe even take a digestive enzyme here and there.
Absolutely.
Yeah. So what about, Jessica, sharing a successful acute or chronic case to highlight the benefits of functional medicine in pediatrics? I would love to hear. I'm sure you've got so many wonderful ones.
I was going to say just one.
Well, you can maybe one acute, one chronic.
Sure. So let's see. So more recently, we had an acute case that came in, and they were actually new patients, but just trying to figure out, they had recurrent ear infections. And through that, you know, everything kind of started abruptly after a fall. And so again, you're like, okay, the kid fell off the playground, and then within that next season, having his ear infection. So to me, it was more of the body's not aligned and things are just not draining how they need to be, right? And kids fall all the time. Babies, toddlers, they're walking, they're falling on their butt. So we started, okay, we need to get some chiropractic stuff going. We need to make sure. And especially things that are unilateral, right? So one ear is always infected versus both. You're not lymphatically draining evenly, right? So we started with that, but then also knowing that, you know, that big foundation, 85+% of that immune system's in your gut. And this kiddo had 6 different antibiotics over the course of 3 years. So we did a gut zoomer on him, and it was just absolutely terrible. And the inflammation was so high, and the zonulin for leaky gut was super high. The calprotectin was even high. So there was just so much inflammation. So again, we kind of worked through the basics of that, and we did some foundational supplements. We rebuilt a lot of that. There was no more belly aches, no more bloating. Mom always thought like he kind of just had that cute little like Buddha belly for a kiddo, which is never normal. And then we started chiropractic stuff, and we haven't had any ear infections. Belly pains are gone, and everything is cool. So if you were just to throw tubes in that kid, though, you're not solving the problem, right? So like, I understand there may be hearing deficits and this and that, but it's because the problem went so long without being fixed. So we have to think foundationally of like why that happens. And we're always, knock on wood, proud to say like our kiddos don't need tubes. Like we don't have to go there because we're able to fix the problem. And then I'll speak on behalf of my own, actually, with the functional cases. But my 7-year-old, like we're rarely ever sick. Like we don't have any issues. He's been like my perfect get-go from the start, did everything right with him. And we ended up sick all last year. And he ended up with like the sudden onset of like this eye tick that was quite interesting to me. And I didn't know if he was just kind of playing with me. And I didn't know if he was having trouble seeing. So we got an eye exam that was normal. And it would happen sporadically. And come to find out, like he was exposed to strep and didn't know it. And so his strep antibodies were higher in the body. And it was actually causing some behavioral challenges. So we did the neurozoomer, and I was able to see how much actually crossed into that blood-brain barrier, and that he had that leaky brain going on. So I knew that we had to fix the gut, the brain, the entire thing. So we just still took strong on that. We used some extra services that I recommended. We have a functional neurologist that we refer to. So we did some neurofeedback and some hyperbaric oxygen chambers. And we were able to resolve all of that. So after 6 weeks of doing treatments, like all his tics were gone. His labs were back to normal. His ASO titers were negative. His neurozoomer was cleared, and we were in a good place. But I think that I always wonder, and it was so intimidating being my own, right? And I say this because like my kids aren't perfect, right? We try our best, but things still happen to us. And, my husband's like, I'm confident that you got this. Like, that's the hardest part. Like, this is my little one now. And like, I have to take all this on, right? But I just trusted in what I knew and what we needed to do. And we were able to resolve it. But again, seeing these kids, especially these neuro kids, I had one on Tuesday that I followed up with for his 6-week appointment. He was kicked out of Montessori school last year, the 7-year-old, for his behavior of how bad it was. And we worked through the TTB and like total toxic burden and doing some detox stuff and working through the liver. And he's now the highest honor student in his Catholic school that he got put into this year.
I have chills.
And mom's like, we didn't need meds. Like, we didn't need to do any of that stuff.
And he would have so easily been put on meds.
Basic, so put on meds. And they just didn't want to. So sometimes that's how they find us, right? They're just in a conversation of that. More and more school nurses are actually telling kids or parents about our practice locally, which is so incredible. So if there's a will, there's a way. And sometimes it's not that easy, right? Sometimes there's deeper traumas, deeper stressors, things that have kind of caused more detrimental effects. But if we can make improvements, that's always our goal. Slightest improvement makes a big difference.
My heart's smiling.
Absolutely. So powerful.
I know we're getting close to wrapping up. I'm curious, do you have any upcoming projects, events happening, anything you're excited to share?
Yeah. So we just opened our second location, brick and mortar. So our hub is in Crystal Lake, Illinois, but now we have opened in Oak Brook. So that was a big thing for us. It's about like an hour and a half or so from our hub location. So being able to find the right team for that, but also being able to reach a different part of the community has been super exciting. And these patients are just absolutely thrilled. Our schedules are filled. They're so excited to, have this opportunity for their kids. And then we're working through a mentorship program to be able to mentor other providers throughout the country to empower them that they can do this too. And here's your resources. And we're here to help you with that because more and more people need to be able to reach these kiddos. And we're here to help them and support them.
Terrific.
That's huge. Cool. All right. Well, we've touched on a lot and I'm going to wrap it up. We have talked about functional medicine and pediatrics. We've really explored how holistic your practice is and you're doing amazing work. I'm so happy we had you on, Jessica. And before we let you go, can we learn a little bit about you more personally with our 3 rapid fire questions?
Oh, sure. Let's do it.
Great. I think, Jen, you have the first one.
Yes. So what is the greatest advice you've ever received?
Ooh. Listen to the parents. Like it doesn't take much to just open your ears and listen. And sometimes again, they don't know exactly what is happening and how they got there, right? So just listen to them, intuitively tune into them and just listen to their heart because that will be the biggest token that you can have to be able to put everything together.
Great. Makes sense. Okay, next one. Who was your role model growing up and why?
Oh gosh. I don't know. I would probably have to say my father's always kind of pushed me to do and had that faith to like do more. My parents always said like I was going to do something big and they just didn't know what it was going to be. Probably with a lot of personality growing up, I could imagine. But, my dad's kind of worked himself from the ground up and, didn't have the traditional like go to college after high school whole thing. And now he manages like a big corporation. But always just kind of been like that side guy that has pushed me and just kind of empowered us to do everything. So
that's great. And you are doing big things. I'm sure they're very proud.
Major.
All right. Last one. Give me a guilty pleasure of yours.
Oh, gosh. There is this place. Now, if my girls listen to this after, it's going to be funny. There is this little ice cream shop in Crystal Lake, and they make coconut milk ice cream, and it is the best dairy-free custard you'll ever have. And that is definitely our guilty pleasure. And I think we have that more than we would like to admit.
What's it called? What's this place called?
It's called Julianne's, and it is amazing. So if you're ever in this area, highly, highly recommend.
Is it just one location? I'm from Chicagoland, so I got to know. Is it a little local chain?
It is. It's just a little local hub, but they make all their stuff, and it is absolutely incredible. You'll never find any ice cream like this place.
Ooh, okay, but they're only in Crystal Lake.
They are.
Okay. Okay. Good to know. I'm
Have to
going
make
to
a
Google
special
them. I
trip.
just like to look at pictures of food. What was that, Jen?
Is that we're going to take a special trip, Emmy?
Yes. Get some
Do
coconut
it.
ice cream.
Do it.
Always looking for good non-dairy ice cream. So if anyone has other suggestions, please send our way. And we should put that in the show notes because, you know, who knows?
Yeah, why
People
not?
might need to hit up Julianne. So.
Pint too, so you can take it and put it in your freezer. So.
Oh, cool.
Awesome.
Nice.
Love it.
Terrible.
Oh, I could talk about food all day.
And speaking of show notes, Jessica, why don't you let everybody know where they can find you on Instagram, your website?
So our Instagram is Well-Rooted Pediatrics, and same with our website, wellrootedpediatrics.com. And then I also have my own Instagram that's linked to our business page, Holistic Peds APRN. And we are just constantly trying to educate, throw information out there, share testimonials, share reels, be real to who we are and what we're here to do.
Awesome. Well, we can't thank you enough today. I've learned a lot. I'm sure our listeners have too. Thank you. We hope to have you back someday. And in the meantime, everybody, until our next episode, stay vibrant. Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness Podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.